So good evening, everyone. I'm going to call the meeting to order. It is 6:33 p.m. And we'll start with the roll call. Just going in order on my screen, Dr. Marla Gold. Great.
It wouldn't mute, I'm sorry. Here.
Dr. Scott McNeil.
Here.
Dr. Ana Diaz-Rue.
Here.
Dr. Amit Ismail.
Here.
And I think that's us so far. Okay. Well, thank you very much. I'm going to turn things over to Ben Hartung to explain the public comment process.
Thank you, Dr. Bedegal. Good evening, everyone. My name is Ben Hartung. I am the Policy Advisor for the Division of Chronic Disease and Prevention, and I'll be facilitating public comment today. If you'd like to submit a public comment about any of the regulations that the board will be hearing this evening, you can do it in the chat function of Zoom, or you can send me an email directly at benjamin.hartung, Hartung, @phila.gov. And the board is required to review your comments before voting on any of the regulations that are heard today, but they are not required to respond to any questions or comments during this hearing. And I'll also like to mention that this meeting is being recorded, and that by participating tonight, you're agreeing that your comments and video will be posted on YouTube as per city ordinance. So thank you very much.
Great, thank you, Ben. So have the members of the board had a chance to review the minutes of the previous meeting?
Yes.
Okay, is there a motion to approve the minutes?
This is Jen move, make a motion.
Second.
And if we could let the record show that Dr. Jennifer Ibrahim has joined. Is there a move to second?
Second.
Got it, yeah.
All in favor?
Aye.
Aye.
Any opposed? Great. Thank you very much. All right, so our agenda for this evening, we'll first consider the Second Amendment to the Emergency Regulation governing the control and prevention of COVID-19, mandating vaccines for healthcare workers and in higher education, healthcare, and related settings. Then we'll consider the fourth consolidated and restated supplemental regulation governing the control and prevention of COVID-19, revised safety measures and delegation of authority. And then we'll consider the amendment to regulations governing the control of communicable and non-communicable diseases and conditions relating to acute flaccid myelitis. So beginning with the Second Amendment to the Emergency Regulation governing the control and prevention of COVID-19. Thank you very much. And is it, Joe, are you walking us through this?
Hi, I can. Let me just give me 1 second. I'm sorry, for whatever reason, I'm having a hard time getting my screen to focus on I have this on my primary screen. Give me just 1 moment. I apologize. Oh, there we go. Okay. So this is a further amendment to the regulation that governs the vaccine mandate for healthcare workers and in higher education, healthcare, and related settings. And the draft regulation that you have actually has the language of the prior regulation, and then language that's being removed from the regulation is in strike through, and the language that has been added to the regulation by the proposed amendment to the regulation is in bold and italics. So you can see on this one, both the language that's being removed and that's being added. And I'm just going to walk through the changes very generally, since you have the exact language that's being removed and added, but feel free to let me know if there's a need to stop and discuss. So the first change on page 3 of the draft regulation is a change to the language of a covered healthcare worker. And it's been changed to exclude individuals who work exclusively in private homes or personal care homes, but don't have any other contact with patients at another location where healthcare related services are provided. The next change is to the definition of who's a covered higher education individual. And in both cases, these are individuals who are being regulated by this regulation and would need to vaccinate if there's not an exemption. So for this purpose, the definition is being changed to only apply to individuals that are over 18 years of age, and to exclude contractors who do work for a covered higher education institution on a sporadic basis. And for this purpose, sporadic means work that's done on an occasional basis, and that's not done predictably at a predictable intervals. Okay.
Joe,
Yep.
Joe, can I stop you for just a second?
Absolutely.
It might be useful if we can just talk about the rationale for each of these changes as we're going through, just in case the board members have any questions. Is that okay with you?
Absolutely.
So for the covered healthcare workers, this came up because both for private homes and personal care homes, they're home-like settings. There were some challenges in terms of, for example, if the worker in a home is related to the person and we're making requirements, but they in fact may live together. So that's something that came up as a situation that it didn't necessarily make sense for us to be mandating that somebody who is able to be a home care worker through insurance and get paid for what they're doing, but is in fact a relative and around the person all the time. The mandate didn't necessarily make sense there. Similarly, personal care homes, because they are that home-like setting, and also because of the kind of disparate nature of them. We don't regulate healthcare institutions in other ways, and there are so many home care, personal care homes that we felt like we were creating a mandate that we didn't have a way of enforcing. So that was the reason for those changes there. And I'll pause for a second before I go on to the next one. Is there any questions or any discussion points there?
It makes perfect sense.
So just one question, Cheryl. So the language there's something that's a little bit confusing to me. Maybe I'm over reading it. So if someone who works in 2 private homes, like more than one, because it says private homes, like someone who works at multiple locations, would they be required to be vaccinated?
If they're only working in private homes, they would not.
Even if they work in several different private homes?
Yeah, and we did, there was a fair amount of discussion internally within the within the health department on this as well. It's interesting how much of the home care landscape is people who are related to somebody, or they're a very close family friend and they're in, and I think these systems have grown up as a way of paying people who are otherwise supports there. We could have tried to separate those folks out, but that became very cumbersome to do. And that was the reasoning for excluding this group, aside from this, just the sheer difficulty of enforcing something like that.
I see. Thank you.
Sure. For the covered higher education individual, this is, for example, a program for high school students that might take place on a university campus, where the students are coming on an occasional basis. They're not spending huge amounts of time on the campus. If you take, for example, a music program at a university, they come for a lesson once a week. It was pretty cumbersome for the universities to have those students all be covered by the mandate. And the mandate was not really intended for people who are kind of occasionally present. It was more of the people who are there living together. So that's the reason for the exclusion for the under 18 there. Any questions on that or comments on that?
Comment, if I may, which is
Yeah.
that would include then high schoolers who are visiting the institution and may stay overnight. So that's usually athletic recruits. It's not that frequent. There are those who choose a dorm experience, and that's up to us, up to institutions rather to allow. But we're just going right by the age, and right, that's it.
Yeah, I'm trying to imagine enforcing it. Like, you could imagine a whole category where maybe you might try, but you know,
Agreed.
so-and-so's little brother is coming for a visit. How are you gonna
That's right.
manage that?
Got it.
Great. I think, Joe, I think we can keep going then.
Great. So the rest of the changes actually deal with the removal of accommodations if an exemption is warranted. So the rest of the regulation, I'm actually going to try to summarize what the changes are, but I'm happy to walk through them in more specifics if there's a need. So prior to this regulation, this amendment, if someone who was a covered higher educational individual or a covered healthcare worker, they needed to be vaccinated if they, unless they had an exemption. And if they had an exemption, then they would need to comply with an accommodation related to masking and related to, related to testing. Those accommodations are being removed. So now it's a vaccination, and if there's an exemption, there's not other accommodations that need to be complied with. And all of the other changes are removing language regarding that, with the exception of, if we go to page 6, under, oops, hold on, this looks like a numbering issue actually. Yeah, I think we skipped 5, but that's okay. We can have a 5 that's reserved. Under documentation required, it notes that although asymptomatic screening testing is no longer required, positive tests should continue to be reported when they're required by other regulations of the board. But those are that is really the summary of the other changes. I will note that the fourth consolidation that we will get to still does require masking of healthcare workers when they're in patient-facing settings. So it's, even though the accommodation isn't required by this regulation, masking isn't required as an accommodation for this regulation, there is still a masking requirement with respect to healthcare workers in certain circumstances.
So any questions about the rollback of the testing requirement or anything else in this regulation? Is there a move to adopt the regulation as currently edited?
I move.
Is there a second?
Second.
All in favor?
Aye.
Aye.
Any opposed? Great, thank you. So we'll move on to the second item on the agenda, which is the fourth consolidated and restated supplemental regulation governing the control and prevention of COVID-19. And actually, I apologize. We should take a moment to allow the board to look at the comments and see if there's any comments that you want to engage with.
I was just going to ask that. Just
Yeah, my apologies. Are you all able to see the chat? Okay, so we'll just pause for a minute and then let me know if there's anything that you want to discuss.
And board members, this is Ben. There was also one comment I received by email that I sent to you this afternoon from Vince Feldman from Children's Health Defense.
Are there any comments that you wanted to discuss before we move on to the second regulation? Okay, thank you. So Joe, can you walk us through the fourth consolidated regulation?
Absolutely. Thank you. So you may remember that there was a third consolidated regulation. This is the fourth. It's basically giving a roadmap to what prior board regulations related to COVID are still in effect, because there's a lot that have been passed that have been rolled back at different periods of time. It just helps provide a roadmap. And for anything that isn't covered in those regulations, it provides a limited set of kind of COVID safety requirements for other certain other businesses. So starting on page 2, I'm really just going to go over the COVID regulations that aren't affected, but are kind of given as a roadmap here. So there's the original listing of COVID-19 and an amendment to that listing that remains in effect, excuse me. There is the 6th supplemental emergency regulation governing control and prevention of COVID that relates to mandatory data reporting. There's a regulation related to perinatal COVID-19 surveillance. There's a regulation related to long-term care facilities. There's a regulation related to vaccine information statements. And there is the regulation as it has been amended that you just adopted an amendment to, mandating vaccines for healthcare workers and in higher education, healthcare and related settings. The following regulations are specifically repealed or superseded by this regulation. The 3rd consolidated administrative emergency regulation is being suspended and, not suspended, superseded and repealed. And also the emergency regulation governing the control and prevention of COVID-19, mandating vaccines for individuals working in and dining at indoor dining locations, that's being repealed. And the emergency regulation of the Board of Health governing the control of and prevention of COVID-19 pertaining to fines and penalties. So in the height of the pandemic, there had been an emergency regulation that increased the fines and penalties that were provided, that applied to board regulations. And so that is what that is repealing. The normal penalties that apply under the code will still exist.
So can I just pause for a second to
Absolutely.
make sure everybody's on board with what we're talking about? And if you can scroll up just a little bit. Great. So in terms of what we're no longer, there are several regulations that we haven't been enforcing, but that are still on the books. And so what we're doing here is first to lay out what is still in force, and then to say, this is what we're rolling back. So essentially, regulations, for example, requiring mask wearing in healthcare institutions still in force. Some of the communicable disease reporting, that's still in force. Positive tests should still be reported from healthcare facilities. Long-term care facilities still required to if they're going to admit somebody who's COVID positive, to have an area where they can be separated. So we're trying to keep people safe in long-term care facilities. The vaccine information statements do need to be given out to people. This is the vaccine requirement for healthcare workers and institutions of higher education we just talked about. And then in terms of what's being repealed, these were some of the regulations on businesses which are no longer in force. So the requirements for vaccines to enter places that had indoor dining, for example, hasn't been enforced for months now, but was still on the books. And so we're trying to kind of clean up, get rid of regulations that we are not enforcing, but so that they're not still on the books and potentially confusing to people. I don't know if there's any specific questions here as we walk through this, or Joe, if you would clarify anything that I'm saying here.
No, all of that makes sense. Thank you for providing more plain language summary. It's wonderful.
Any questions from the Board of Health on that before we scroll through the rest of this? Okay. Thanks, Joe. If you want to go ahead.
Sure. So then there's 2 other pieces of the regulation. On page 4, there's a delegation of authority, essentially just noting that the delegation authority that's previously been given to the health commissioner remains, and that if it's needed between board meetings, that additional control and prevention measures can be implemented on an emergency basis. And then and also as has previously been delegated, that the health commissioner can continue to roll back regulation and exercise enforcement discretion and so on between board meetings. And then actually, Ben, if you'll scroll up just very quickly to paragraph B. In addition to providing that roadmap that we discussed, this consolidated regulation also adopts revised safety measures for continued full reopening. And those are what I'm going to go over now, just very briefly. And if we scroll down, those are in attachment A. So these are first, with respect to masking, there's still a requirement that businesses allow masking that cover a nose and mouth if a worker or a customer or employee chooses to do so. So that applies generally to businesses. Face coverings are required just in two general areas now. One is healthcare institutions. If they're in a patient-facing setting, and employee-only areas, masks are no longer required. However, if an employee returns to work following a high-risk exposure or testing positive for COVID-19, then masking is required, even in employee areas, consistent with guidance from the Center for Disease Control. And then the other area where masking remains required is in congregate facilities, such as prisons, shelters, and adult day programs. And this is in indoor settings. And the definition of indoor has remained the same from the prior board regulation, a location that's enclosed by 3 or more walls or other non-permeable barriers and an overhead covering. And then there's exceptions, both in terms of who the masking requirement applies to and in terms of situations such as eating and drinking, or when someone's alone, that remain the same from prior regulations. Are there any questions, or do we want any further comment on masking before we go on to isolation and masking requirements more generally?
No questions.
So section 2 provides that businesses that are operating in the city must allow workers who are diagnosed with or test positive for COVID-19 to remain absent during isolation in accordance with guidance provided by the Department of Health. And with respect to masking of close contacts, businesses, organizations, and other establishments should encourage workers who are close contact to mask for 10 days following the date of their last exposure. Section 3 provides that the owners and operators of businesses, organizations, and establishments are also liable under this regulation for noncompliance by employees with respect to the requirement that they allow employees to isolate, excluding the actual isolation requirements, which are the responsibility of the individual workers, and also with respect to allowing masking if an employee, or excuse me, if a patient or employee chooses to mask in their establishment. Section 4 is generally just an interpretive language, and also provides that businesses must continue to allow inspection of ongoing operations as further clarified by guidance by the department as a condition of continued operation. And that's all I have.
So Board of Health members, any questions or points that you'd like to discuss here?
So can I ask just one question? Can you scroll back up to section 2, addressing worker isolation?
Yes.
So I just wanted to be clear, in part A, where it says worker isolation, where it's saying during isolation in accordance with guidance from the Philadelphia Department of Public Health or healthcare provider. And is there, I guess I just want to be clear what that's referencing back to. So how, based on this, what would somebody know are the latest recommendations or the guidance in terms of what isolation is?
Yes, so we have guidance on our phila.gov/COVID page on this, but it would be the 5 days of isolation after a diagnosis or positive test for COVID. And then on the masking front, it would be being allowed to mask for days 6 to 10. So just to be clear, the requirement for the employer is that they permit the employee to isolate. They obviously can't control what the employee does or doesn't do, but that they shouldn't be forcing people to come into work with COVID. Any other questions or comments from the Board of Health?
I'm just trying to quickly read the current masking recommendations for close contacts.
Yeah, so this is basically consistent with the CDC. Anybody who's a close contact of someone with COVID is supposed to mask for 10 days after that exposure. And so this is saying that businesses, other organizations should encourage that to happen. So now if we can turn to the comments from members of the public in the chat, and I'll just pause for time to read those. And then if any of the members of the Board of Health would like to engage with any of those comments, please let me know.
And board members, I did receive one further email comment that I forwarded to you.
Okay. So members of the Board of Health, any comments from the chat or from email that you would like to discuss at this point? Okay. Is there a move to pass the regulation as currently written?
So moved.
Is there a second?
This is Jen, second.
All in favor?
Aye.
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 Any opposed? Thank you all. And finally, we will move to the amendment to regulations governing the control of communicable and non-communicable diseases and conditions related to acute flaccid myelitis.
Good evening, everyone. Can everyone hear me?
Yes.
Wonderful. My name is Jessica Baptiste. I am the policy director for the Division of COVID Containment and also the Division of Disease Control. I will be running through the amendment to the regulations for acute flaccid myelitis this evening. The first page are the whereas statements, which basically give the history of AFM, as we will refer to it, here in Philadelphia and in the surrounding area. AFM is a serious neurological condition, specifically affecting the area of spinal cord, which causes muscles and reflexes in the body to become weak, mainly affecting children. There were a few cases of AFM in patients in the Pennsylvania area and mainly bordering Pennsylvania in 2021. And it is associated with poliovirus. We have been asked to add it to the list of reportable conditions as it has been linked to or associated with poliovirus in the case that it has been in the surrounding area, and we'd like to make sure that we have it on our list. It is a requested reporting for the state, and this adding it to the list would make it required reporting within 24 hours for Philadelphia. It would be reported to the Acute Communicable Disease Control Program. Some of the other considerations, isolation is not required. Concurrent disinfection are standard contact and droplet infection control protections. Moving on to page 3, quarantine would not be required. And monitoring would be via close contacts through the department if necessary. Are there any questions?
It's clear.
Jessica, can I just ask one point of clarification? So at the top of this page, if polio virus, wait, go back. Right there. If polio virus is suspected, only healthcare workers with evidence of immunity. So I'm assuming documented vaccination.
That's correct. And as it stands, I believe the CDC is handling many of the samples. So stool samples and some of the other samples that are required via the CDC protocols are described in that documentation that we would make official along with our guidance. But yeah, it would have to be someone who has documented immunity. And I'll also be collecting questions to send to our acute communicable disease program manager, who can also answer the questions of board members.
Are there any other questions or comments from the Board of Health on this regulation? Okay, so I'm going to now ask the Board of Health to turn your attention to the comments in the chat. We'll wait a few minutes so that you can review those and then let me know if there's any that you would like to discuss or engage with otherwise. Okay. So is there a move to pass this regulation as written?
So move.
Is there a second?
This is Jen, second.
All in favor?
Aye.
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 Any opposed? Thank you very much. So that completes our agenda. Are there any other points the Board of Health would like to discuss this evening? Well, thank you all very much. We'll adjourn the meeting. It is 7:06 p.m. Thank you very much for your time and your service to the city of Philadelphia.
Thank you.
Good evening.
Thank you. Have a good evening.
Thank you. Take care.
Well,